medical student is preparing a patient for an appendectomy. He is asked by the surgeon to disinfect the patient's skin with chlorhexidine isopropyl alcohol solution before the procedure. Recent studies have shown that this solution reduces the risk of surgical site infection substantially compared with povidone iodine preparation without alcohol in clean contaminated surgery. So which of the following mechanisms best describes the mechanism of action of chlorhexidine? Mechanism of action of chlorhexidine. Okay, so let's directly go to the explanation. Chlorhexidine, active agent against gram-positive and negative bacteria, facultative anaerobes, aerobes, and yeast. Depending on its concentration, it can either be bacteriostatic or bactericidal, and the bactericidal effects result from a binding of the cationic molecule to negatively charged bacterial cell walls and extramicrobial complexes. So at low concentration, this causes an alteration of the bacterial cell osmotic equilibrium and leakage of potassium and phosphorus that results in a bacteriostatic effect. So this is what's happening at a lower concentration. It's bacteriostatic at a lower concentration. At higher concentration, the cytoplasmic contents will precipitate and result in cell death. So its activity depends on the pH. Optimal activity occurs between the pH range of 5.5 to 7, and activity is greatly reduced by the presence of organic matter. So this is something you just need to memorize a bit, but it is important. You can see a couple of questions on this concept. Okay, so there's not much to explain here. You just have to go ahead and memorize. The key point here would be to know that chlorhexidine, its activity depends on the pH. So that's the take-home lesson from this point.
Thanks for watching. Please give a thumbs up and subscribe for more.